This is a very difficult slide to read, so I'm not going to spend much time on it. What this slide tells us is how often we prescribe drugs, and this is a global snapshot that comes from a company that tracks these things. And the take-home lesson from this slide is, of the 15 most commonly prescribed classes of agents of any kind, you've got antidepressants and antipsychotics coming in number 6 and number 7 on that list. Right now, according to these, these are the sales in millions, because antipsychotics are more expensive, they come in even higher, more often than do the antidepressants because they are so expensive. But that's a lot of medication that we are using. And here's just another breakdown of that, showing that 2 of the atypical antipsychotics, Seroquel and Zyprexa, remain among the most heavily prescribed drugs of any class. On this list, we do have one of the antidepressants, Effexor, venlafaxine. What you would have seen a few years ago is venlafaxine, Effexor, really right at the top of that list, and antipsychotics someplace down at the bottom or not at all. But because there's been so much marketing effort put into these drugs, you see them rise up on this list. Think about it. There are not that many psychotic people in the world that these drugs would be competing right next to things like agents that are used to lower cholesterol or to treat heartburn, some of the most commonly prescribed agents of any class. And this is another snapshot that shows these things again overall, and I won't spend any time on it except for to say again we have antipsychotics and antidepressants. Whether or not you measure in terms of volume of prescriptions or total numbers of, or the numbers of dollars that we spend on them, always come very, very high on that list. In the United States, taking another look at these data, I just wanted to show you a couple of things. Seroquel, the atypical antipsychotic Seroquel, in 2008 had sales of almost $4 billion, $3.9 billion. In 2004, sales of Seroquel were $2.1 billion. Okay, so what does that tell us in 4 years' time? We got twice as crazy in 4 years than we were in 2004. The indications for Seroquel are bipolar mania and schizophrenia. We have that many more bipolar manics and schizophrenics in the United States in 4 years. I don't think so. So what does that mean? It means that we are using this drug for many, many off-label indications, such as irritable mood, behavioral disorders in adolescence, and the like, sometimes even for sleep. Seroquel is used just to put people to sleep in spite of its negative side effect profile. And we're spending a heck of a lot of money on it. Lipitor, the cholesterol-lowering agent, makes about twice as much money, but $4 billion a year spending on these. People worry about the opportunity cost of doing this. How much of that $4 billion a year could go towards providing psychological interventions for patients who may need them? We are truly making a choice, and this is something that policymakers are becoming more and more aware of, that there is a real choice here, and there are real opportunity costs if we put all of our eggs in the pharmaceutical basket. Down here is another atypical antipsychotic, Abilify. You see the same pattern, $1 million in 2004, $3 million in 2008. When you look down here, these are 2 antidepressants, venlafaxine or Effexor, and escitalopram, Lexapro. Now here's an interesting story. 10 years ago, you would have seen a trajectory very similar to this, maybe doubling in size over 4 years. But look at this. In 2004, venlafaxine had $2.6 billion of sales. In 2008, $3 billion in sales. Okay? Hardly a blip. It just went up a little tiny bit. Why? It's going to go off patent. People are thinking again about antidepressants and how we use them. A lot of reasons why we're not paying that much attention to them anymore. Similar for escitalopram, a newer one. It's gone up some, but you don't see anywhere near the rate of rise with these medications as you do with the older ones. with the antipsychotics which are being heavily promoted.
I think it'll be interesting to see what happens with Abilify, because now they're promoting Abilify
Yes.
as adjunctive therapy.
Treatment-resistant depression. That's right. That's right. So again, Abilify is not devoid of the risk of tardive dyskinesia. It is not devoid of risk of metabolic syndrome, which is one of the principal safety factors with the second-generation antipsychotics. I worry a lot about its use, more widespread use. So this is, again, just a little bit of an illustration of that. This is just in terms of the total of dispensed prescriptions, 143 million for an antidepressant in 2004. That's gone up about 20 million in 2008. But when you look at things like the drugs for seizure disorders, which were 82 million prescriptions in 2004, gone up almost 30 million prescriptions in 2008. That's an extraordinary increase, and we don't have that many more patients with seizure disorders. So again, off-label indications and use for in a number of conditions that we're not really sure these drugs are terribly effective for.